It's good to see everyone here this morning. This is the midwinter meeting of the American Academy of Biological Dentistry. Sounds pretty official that way, you know. And I'm glad to see everyone here. I think today we're going to learn some things that we are not aware of, not only from Dr. Yiamouyiannis, but from Bill Moore, who's going to be is on his way up here. They had a big delay back east. I guess the eastern seacoast was fogged in and all the flights were canceled and everybody didn't get here at their appointed times. So John, as you all know, John Yiamouyiannis, Dr. Yiamouyiannis, is probably the country's leading proponent of anti-fluoridation and the evils of fluoridating drinking water. He's brought us some new information on this point. Our Academy has not addressed this issue as yet, but we will get into it because I do get requests from all over the country for information on it, and I just refer them to Bert Stoller's works and a few other things. We've been trying to develop our focus on, of course, biological dentistry, which includes the fields of toxic metals, dissimilar metals, electrogalvanic currents caused by dissimilar metals, hidden infection, and of course the whole idea and concept of detoxification in its relationship to the ground substance. That's the focus that biological dentistry is going to take in the next 10, 15 years. Dr. Yiamouyiannis was a former editor of chemical abstracts and a co-worker with Dean Burke in cancer studies and as related to fluoride. He's also the president of the Pure Water Association, is that correct? Safe Water Association. Okay. And I think without much more on my part, we'll have Dr. Yiamouyiannis come on up and start his talk, please.
Thank you, Ed. I'm not usually used, especially in such a small room like this, used to using one of these microphones. And I asked Ed if we might use the microphone or not use the microphone. I'm going to turn it off for 1 second. And how many of you can hear me quite well?
What?
I said, seriously, how many can you hear me in the back of the room quite well? If you have any problem or you think you'll have any problem with tape recorder, anything of that sort, I'll be glad to turn it back on. But I feel more, I should say, closer to you this way rather than having it beam out from you from some other place. So I probably should say by show of hands, who would rather have it this way and who would rather have a mic? Who would rather have it this way? Who would rather have a mic? I guess I must have intimidated somebody. I'll put Harry down here. This morning...
Is it all right if we send these tapes to the ADA? Is there any problem?
Oh, you can send them...
FDA.
The only problem is you're wasting a tape, but you can send them to the ADA if you want to. It's a waste of your money, and it's a waste of the resources. But feel free. We have a program today. One of my characteristic personality traits is I usually never follow anything carefully. But I do try to outline on the program the things that I want to hit. And again, I'm here to speak to you. I'm here to address your needs. And what I'd like to do is sort of reset what I'm going to be saying. I can follow this exactly the way it is. I will be presenting some exciting new information on how if anybody read the Newsweek. How many people got a copy of the Newsweek? So on the top there, what does it say on the top there?
Fluoride risk.
Fluoride risk, and what does it say underneath that?
Evidence of a link to cancer.
Right, and the title of the article is Don't Drink the Water. Now this would have been unheard of 6 months ago, just like the East European revolutions and so forth. This didn't come about by chance. Now, I can tell you the story behind the headlines and go on to the program, or we can start with the program and later on in the day I can tell you the story behind the headlines. Which would you rather have? Let's do the program. Do the program. Okay. Okay, what's your problem? This is how we're starting. And if there would be somebody who takes very, very good notes, see me afterwards, because quite seriously, there are things going to be said here today that I want to have. So if somebody will volunteer to take careful notes, I'll Xerox them before I leave. Anybody?
Yeah.
Ed will? Okay, great.
What did I volunteer for?
I'll take notes, he doesn't even take
Oh,
notes.
you didn't take notes. Please, somebody, I mean, all I want to do is photocopy your notes. Just be meticulous.
Why don't you have somebody transcribe the tapes? They're really easy to do. It's an hour. Later.
That's probably wrong.
Okay.
I nominate Gary Bassett.
Thanks.
All in favor, say.
Aye.
Gary takes notes, but I can't read them.
All right. Somebody, when you get done, you know, who has somewhat good notes, please let me make a photocopy. Okay, what's your problem? And this is really an open forum for me to understand what your problems are. I mean, I probably have a general idea of what they are. But before we address the problem, I've got to know what your problems are. So, and this is, you know, harassment by state authorities, by local authorities, by dental authorities, by medical societies. Problems that you've had personally first, and then we'll probably go into the more general problems that you want to deal with through some type of legislative legal defense fund.
All of the above, but we'd like to avoid having it personally happen to us.
Yeah, this is prevention. This is damage control ahead of time. So let them know that we're there at the foxholes and we're going to get it in the eyes as they come after us.
Okay. So my note taker, please put prevention as the #1 thing. I'm glad to hear that because that's the area that I specialize in. I was going to say that no matter how good you are at prevention, you know, things always happen. I'm quite sure that many of you have looked after children and so forth and noticed that you might, after 10 years or so, out of 100 children you're examining and taking care of, one might get a cavity. So once in a while you're going to have a problem. The whole thing is how to prevent these problems. And in any good legal assurance program, prevention has got to be on top. And now how do we prevent things? Well, we'll be talking about that later on, but let's continue on. Let's talk about some of the crisis situations that we do get into. Where are they getting us? Anybody? Where are they getting you? Is anybody here any problems at all, or? Yeah.
Well, I've had an insurance company complain to the State Medical Society that this is not accepted medical practice, which was treating the yeast syndrome, by the way.
Okay. And you're a dentist, or?
I'm an MD.
MD. Okay, let's put that down.
We're concerned about the profile they're making, the Emprise, I guess, computer program. They set it up by Stephen Barrett and Miss Monaco, Mrs. Monaco, Jarvis, about the computer profile so that they can pinpoint red flag alternative practitioners and either not pay them or go after them for some reason or another.
Okay, so whoever took the notes, prevention is #1. The second one is not accepted practice. In other words, they're going to set standards for us to deal with, and we're going to have to follow that. And that's one thing we don't want to do, and we want to show people why this is bad.
Especially with PPOs and HMOs and the sort of collectivism we see coming.
Okay. Right. And put PPO down, whoever's taking this note, please. These are the minimum things that I want to have. Then a profile. In other words, there must be developing some dossier or something of the sort individually
Yes.
on who to target. So we're being professionally damaged by them, which I love. And it's just terrific because it allows me another aggressive move. Yes.
Medicare has already got us collecting their databases for them because we have to list their diseases in order of which they came to see us. And then if you don't have disease proven, you have to list their symptoms. And I'm sure it's no imagination that in a year or two, they're going to have enough database to say, okay, you did this for these symptoms. How do you justify it? We're not going to pay you. You did this. It'll be a real disciplinary tool, and we're just at the first stage of it now, and it's required.
Okay, so the third note I'd like to put down is database. That they're trying to get a database for the purpose of exclusion from payment. And this is true of both Medicare and it's true of private insurers.
The kicker in that one, though, is not only will they say you did it wrong, but they'll require that you pay it back with a penalty.
Okay, and then the fourth one is consequences. In other words, consequences of their developing this profile, which is repayment requests as well as penalty charges. Okay, what are the problems? I know we have other problems. Yes?
As a dentist, I'm concerned about the charges of crossing over to practice medicine. That line there, I want to clarify that to people. and to
Okay.
myself.
The fifth item, please, is the line between dentistry and medicine. And I'll further define that as we tried to define it. In Ohio in 1980, they tried to pass a Medical Practices Act that was going to put everything under the control of the AMA, just about. Our laws depend on what AMA says. If the bylaws of the AMA change, our state laws change because in our state law, we had it, if a person does anything against the ethical, whatchamacallit, of the AMA, they shall lose their license or be guilty of a misdemeanor or something of the sort. So without our state legislature even knowing about it, AMA can change their code of ethics, and they changed our law. One of the ways to get around that is to require, and this is political action again, go back in, go to your state legislators, or in my opinion, replace your state legislators. The only way we can get our laws passed right now is not by reason. It's by means of just sheer pressure. The only way I was able to stop the Medical Practices Act in Ohio was by means of a rally of about 5,000 people on the Capitol steps and the largest letter writing campaign we ever had. It's not because they liked us. We have one of the strongest, most notorious speakers of the House, Ronald Wright, in Ohio. He opposed us. I think it's the only bill he ever lost, where it was passed 33-0 against us in the Senate, and we turned it over in the House where he was the speaker. He usually has the House in firm control. But I can tell you, we have short-term solutions. I mean, here's a guy coming in with, bleeding mouth and so forth. You got to take care of him right away, but we have long-term solutions too. We've got to, set the basis in there. One of the bases we have to be thinking about in the next few years is replacing those legislators. They are causing a low-grade disease in our government today. I'm trying to give you the analogies, but it's true. It's exactly the way it works. That's the first thing. The second thing is when we defeated the Medical Practices Act, not only did we defeat it, but we put some of our things in there instead. One of the ones we didn't get, and one of the things we have to get in every state in the union, is a careful delimitation of what the practice of medicine is, which basically is something the treatment of disease, mitigation of disease by drugs, devices, and so forth. But items like nutrition should not be in there. That's not the practice of medicine. That's not what we're talking about. So what we want to do is carefully limit what is meant by the word medicine. We want to define medicine, which in most, they define the practice of medicine, but they don't define what medicine is. We want to define what medicine is, so that most of what you would do in dentistry wouldn't even be going into medicine. It would basically be prevention, nutrition, whatever it happens to be along those lines. Medicine should be something entirely different. That's one of the ways to solve your problem. Right now, of course, we have a crisis situation because the person is wondering where they go or where they don't go. And on that, I would say legislation definitely is the first step to clarify this. And the second step is, in the meantime, myself, if we get together in some type of an agreement, myself and an attorney or a group of attorneys have got to be able to tell you how far you can go under the present law, so you know where you can go. When you're stepping over the line, you know you're stepping over the line. It's not some type of a gray area. Unfortunately, we have to be this careful. But I think once we do define, restrict the definition of medicine, you won't have this problem.
Some of us use testing procedures that are considered experimental or investigational, and based on those results, our treatment protocols are significantly impacted. We don't expect to get insurance payment for that. However, it still puts us in a gray area as far as treatment is concerned.
And we're talking about new treatments?
Yeah, these are relatively new, yeah.
Okay. When we have new treatments that are coming out, and if we ever progress, or hope to progress, in the health area, maybe so that we'll have teeth as good as the Myurans did, 2,000 years ago, that's progress in dentistry. They did have problems, by the way, but dental problems, at least sound teeth were not the problem. But I think, so far as I know, somebody may correct me if I'm wrong, they're known to have had all their teeth at the time of death. There was virtually no tooth decay or filled. If it was missing, is because some jealous wife or husband knocked a tooth or two out. It wasn't due to degenerative diseases. So, research that even leads us backward, or research that leads us forward in dealing with the problems we have in society's modern diets today, have got to be, we've got to have these things, otherwise we're not going to go any farther than we are right now. And I will say that despite what we hear, there have been, in general, some advances in dental care. We may have been doing some damage, but at least from the statistics that I've seen, at least up to the age of 17. Now maybe after the age of 17, they go downhill faster. But we do have the ability with, how should I say, fairly non-invasive techniques for improving dental health in this country, and periodontal health as well. But we want to go further. Now, how we go into these new methods, it's always been a problem. Change has always been a problem. But there's always a procedure. And the procedure is to get an IND. For investigative new drugs, investigative new devices, we can apply for them for one or a group of practitioners to engage in a particular practice. Now, for the longest time, fluoride had an IND for the use and treatment of osteoporosis. It was never FDA approved. And the most recent studies show that if anything, fluoride, besides causing the adverse effects that occur with the treatment of osteoporosis with fluoride, the newest studies show that overall patients are worse off with the fluoride than they are without it. But this was all done under IND. So you can do some pretty harmful things with the IND and get away with it. A number of patients who have been harmed with it. All I'm saying is, you might have more than an advantage than you want with an IND, but an IND is the way to go, rather than just take a person to the back room and slip into here and so forth. Before you walk in this machine, give me $50, and you can't report this to your insurance company. Get an IND. I don't know, and I probably have to have an attorney here, but I would imagine as to whether IND treatment is insurable or not. It may even be insurable. But the whole thing is, rather than going haphazardly into these things, you go into it carefully. You belong to a group like this who lets you know not only what the latest research is, but what you can do with the latest research. Next, what other problems do we have? Those are easy problems.
How do you get the IND?
How do you get the IND? You apply to the Food and Drug Administration for IND forms. And if you want an IND, probably the best way to do it, if you're in a society like this, write to Dr. Arana. Dr. Arana, if we set up a legal defense fund, would send it in there. That would be applied for you. We would probably also have Dr. Arana send out asking if anybody else in the group would like to be a part of the study, whether it's that electronic device that you use or whatever it is. List a number of people who will be investigating, records to be kept, which is reasonable. It's a new treatment. If it works, fine. If it doesn't work, we want to see, as well as we don't want to hold it back to the Food and Drug Administration. If we're successful and the procedure seems to work, we can get FDA approval for whatever that means. It just means that we'll get insurance payments. Really, I can tell you, just because you get FDA approval doesn't mean what you're doing is good. But you can get insurance payments on it, and you will not be harassed for the use of that treatment. That's what FDA approval means.
Is it likely? Is this something they give out if it's reasonable?
Oh, sure.
Doesn't hurt
Absolutely.
somebody.
No. The amazing
That's
thing.
amazing.
The amazing thing is, people are so afraid of walking in the front door and getting what they want, before they even try the front door, they come through the back door. And sometimes they find the back door is locked, and they tell me, see, there's no way of getting in. Well, most people keep their back door locked. You know, if you go to most stores, retail stores on the street between 9 to 5, the front door is open, and there are more back doors locked than there are front doors locked. You go in the front door. When I went to the American Dental Association, I needed some data that the American Dental Association had with regard to the amount of money that dentists were paid, something that only ADA had. I couldn't get a Library of Congress, National Library of Medicine. I have an excellent library center in Ohio, so I flew out to Chicago, walked in the library, asked for everything I want. They said, are you a professional? I said, yeah, I'm not a dentist, but I'm a professional. So, do you have a business card? Pull out my business card with my name on it, and I'm public enemy #1 over there, John Yiamouyiannis. At the time, I was science director for the National Health Federation, the most hated health rights group in the country, and again, one of their arch enemies. And they said, that'll be fine. They didn't know me, you know, from Jack Smith. And I got all the material I wanted. When I needed more material, I sent to them. They sent it to me with a postage-paid envelope to send it back to them. It's easier. It saves time going in the front door. All you're going to find is a locked door if there's no one in. Yeah, absolutely. I think it's one of the problems we have. We keep on making our problem harder than it really is. Any other? I can think of worse problems myself that you must have. But if that's all the problems you have, I mean, that's easy to deal with.
Give us
What? Any people have a fear of the quality assurance boards getting on your back? Anybody have any fears of losing your license?
Yeah.
Well, but those are the minor problems. You don't concern me. Come on! I want to hear some of these things. That's what it says here, you know. What's your problem? I'll tell you my problems, you know, after the lecture. Yes?
Question before we move on, is it possible going in the front door will attract attention to us?
I hope so.
And a manner in which we would find disadvantage?
No. If we go in the front door, you know, when you go shopping, you don't wear hair curlers, yeah, and a nightgown. When you go shopping, you go to the front door, you know, dress reasonably well, like you dress now, or like Dr. Around is dressed. When you go in through the front door, you want to look good, and you want the public to see you going in the front door. That's the other thing. You want the public seeing you going in the front door, because the public sees you and you look good, and then you get kicked out. Then you cause a stir. You cause a stir because, let's say, for example, we have some reasonable thing, some new treatment that's going to reduce tooth decay among children by such and such an amount, and improve dental health, and so forth and so on. Before you go there, you might even want to say, you know, make a little, have a couple of press releases, show preliminary data. You're going for an IND now to seek FDA approval. By the time you go in, let me tell you, by the time you go in that front door, it is impossible for them to kick you out, and I've been in that position many times. If they do kick you out, it hurts them. And I'll show you one situation that occurred with this fluoride thing, where the ADA tried to kick out, and they have become so reactionary that CBS Network News won't even talk to them anymore. The word I've gotten is they don't even believe them anymore. And that's great for us. Because if the agency that's supposed to regulate us properly treats us shabbily, that agency or those people in the agency aren't going to be around much longer. But it's not going to hurt us. We have got to put up a reasonable front and behind and the middle and everything. We've got to be reasonable. We've got to have something of substance to present to them. If we have something that we aren't sure of, well, we better work it out first before taking it down. Ed, I'm sorry.
Well, there are a couple of organizations that are calling for the collective investigation of electrodermal devices. Okay, the one is the Bioenergetic Association in Hawaii, headed by Julian Tsui, and they have a large money grant, and they're going to start some studies. And if you had the right kind of instrument, you could get in on the study and kind of right in under that investigational protection. And that's been going hanging in the fire for 2 years now, but it isn't off the ground, but they do have the money. I don't know what's going on
Do they have the approval?
Yeah, they have the approval. I mean,
FDA approval?
well, I imagine they would have, yes. The first study, I believe, was going to be point measurements in relationship to prostate cancer. And we, as an academy, we're going to start a study with Robert O. Becker using silver ionophoresis. Now, from what I understand about ionophoresis, it's an old idea. You know, back in the teens, they were investigating this. But he found some things that it does that we're going to be reporting in our journal, which there's been a little delay for the new issue, but it's going to be in that one, and where you have several things happen when you apply electricity to the body, current, injury, strength. You de-differentiate the cell to make it more primitive, make it totally potent so that it can re-differentiate into whatever is supposed to be there. The ions that you use as a cathode, as an anode, positive pole, you drive those silver ions across the wound area, and it kills the bacteria, the viruses, and the fungus that are there. And he says that you could heal any wound in 3 days. This is what he tells me. This is from the work that he did at the Veterans Hospital that he reports in The Body Electric, and he talks more about in his new book called Cross Currents. So I was going to get up and ask all the dentists here and physicians too if they wanted to get in on the study. The first thing we're going to do is infrabony pockets using that kind of instrumentation, but that is not new instrumentation. That's old stuff back from the schools of electric medicine back at the turn of the century.
Well,
Yeah, but is it-
is
Is it accepted today? Doesn't matter how old it is.
Well, yeah, there's a recent book written out on dental ionophoresis by Quintessence. I mean, that's published 2-3 years ago and right up to date. And they even sell units that do this kind of thing, but they're using it for a different reason. They're not using it for healing.
Right. Sensitivity, that's the thing.
But you can imagine the implication of having a device where you can actually heal a wound in 3 days. I mean, that's unbelievable.
No, that's not with the silver treatment, is it?
Yeah.
Silver treatment is
Yeah. Right now, that weak currents of electricity, people are applying that to the problems that they have, and even that's working.
just the currents,
Just the
without
currents,
the
yeah.
silver.
Without the silver.
Okay. Well, I'll say this, that if you get into something like this, try to avoid the problems of the past. Try to avoid the idea that this is the method and there's nothing wrong with it. Go in with it with an open mind, and hopefully 1 or 2 or 3 or 4 people should take a devil's advocacy position and try to do research as to why this might be harmful. Silver, as soon as I hear silver, I think of the same thing as you think of when you think of mercury. It's a heavy metal, it's toxic. We're forcing heavy metal into tissue, and if we're causing an improvement in one thing, are we doing it at the expense of something else? And discuss this in your journal. Allow both sides to come out. It not only is good for you, but in the sense of the truth, but it's also good for you if legal questions should come about that you weren't trying to cover up the way ADA has. I mean, really, ADA is an old dinosaur just waiting to fall over, except it's propped up by so much money and special interest right now. As I view it, I see a dinosaur with scaffolding there to keep the thing up, and that's what the ADA is right now. As soon as we so-called mature and lose our certificates as an association and become so specialized that we can't change at all anymore, we end up like the ADA. We got to be propped up because you can't even move without falling down. So you've got to keep this thing open all the time. Some groups do it by means of maturing, and a splinter group goes off somewhere and builds itself up and the original structure dies. It would be nice to have a group that continually reminds itself it's got to be open on every one of these issues. But if you go into something like that, it definitely would stimulate active discussion. And always be looking. When I did the fluoride work, the fluoride cancer link work originally, Burke and I were continually trying to find something we hadn't looked at to disprove our study. And we would have known it long before the other side would have. And it's real important. It's real important that if there's something wrong with whatever you're doing, you find it before your enemies find it. And, you know, and when you do make a mistake, when you do make a mistake, admit it and just move on. But these types of things, as far as I'm concerned, there can be, I think there can be more than one IND on the same device. So if you need another IND or somebody's delaying or not pursuing an IND fast enough, you can go ahead and get it. Yeah.
Well, there's another point that the dentist should be aware of in the room. There was a group of us, it was 8 of us, that took the first dental certification for acupuncture in UCLA this last December, last 4 months of last year. And they, in November of 1988, they changed the Dental Practice Act to, they made an amendment that included podiatrists and dentists, and they talked about the use of acupuncture. Previous to this time, the acupuncture ruling that they had under the Dental Practice Act was a dentist could not employ more than 1 acupuncturist for every 20 dentists in his employee. Huh? In other words, how many guys have 20 dentists working for them? And they could only employ 1 acupuncturist. That was the law.
Yeah.
Then they changed this, and now it was that they set the definition and the limits to include electroacupuncture and other non-invasive stimulatory techniques. Okay, well, we use that, and that's the big contention that they have. We use that for diagnostic purposes, okay? And so, under the acupuncturist certification, as a dentist, we now, by law, it says in there, and I wrote a little note to this in the upcoming journal about this, our foot's in the door, and that we now have legal justification for using that instrumentation, because it's law, unless they change the definition of words.
Or they can change the law again.
Or they can change the law again.
Yeah, see, that's what you've got to worry about, the changing the law again. Once you have something, doesn't mean you're always going to have it. What will assure that you will always have it is if you start getting an IND for it, trying to prove that it works or it doesn't work, or whatever happens to be the case. Yeah. And that will make it much more difficult for them to legislate that out.
Well, the dentist may want to take that particular course because it's going to be given again.
You know
this
what?
coming year.
This year?
This year.
You have to have the certificate in order to qualify for that, then?
Well, that appears that way.
No, you don't have to have a certificate, you just have to have a certain amount of hours that you have had curriculum and hands-on with acupuncture by an accredited acupuncturist or an acupuncture college that teaches acupuncture. It doesn't have to be a certification, there isn't a certification, according to what the State Board Dental Examiners say.
How many hours?
85 hours.
Well, it was listed as that, I know your situation, but it was listed as a certification.
Because you have to pass a test.
You have to
State
pass a
board
test, like a state board test, which we took. In other words, so, and thank God Wade Chow's doing all this. He took it under his own initiative, and it took him 7 years to get this thing passed. So there's an avenue now for the dentist to start utilizing some of these other techniques without being harassed by it, them saying it's not the current standard of practice. Well, the current standard of practice is that dinosaur propped up with a scaffolding. You know?
Well, the current accepted practice is one of the things, quite frankly, you're going to have to center. And this is one of the first issues we brought up, or the second issue that we brought up. We have got to get away from this currently accepted practice, especially when currently accepted practice, for example, silver mercury amalgams, is in places like Sweden being phased out. I mean, if the only thing we can use is currently accepted practice, and it's obvious that currently accepted practice is dangerous, that means we can't use anything. So we really have got to hit that hard. We can't afford to go with this currently accepted practice business. There are situations where we're going to have to move ahead. What's currently accepted now won't be currently accepted in 10 years from now, and there's got to be a way of getting from here to there. Most people understand that.
It's last century thinking.
It's, you know, it's dark ages thinking. Hopefully, I don't know, I'm getting as dismal as I've been in the last few years, and I am pretty dismal about American politics. We could talk about that for the rest of the day. I have a feeling, some unrealistic, irrational feeling of hope that things are changing. When I heard this said before, I didn't believe it, and I had good reason to not believe it. But I think there's certain things that are changing, and I can't say they're going to change for the better or for the worse. But we're getting into a phase now where the direction we're going is going to shift somewhere, and now is the time to apply the pressure so we make sure it shifts in the right direction rather than the wrong direction. But I think things definitely will change, and they can change for the worse, they can change for the better. If we work on it, we can change for the better. Yeah.
Now, if you are in one of these IND studies, do you envision that the Medical Board of Quality Assurance is not going to come down on your case for doing some of this thing? Does this give you some sort of an exemption?
It doesn't give an exemption. I mean, we all have to be responsible for our actions. Just because you get, say, a policeman's badge doesn't allow you to go on the street and shoot people dead. It doesn't allow you to malpractice on your patients any more than Ed, who might not be in the IND program. But what it does give you is a little aura of authority, and it will probably make you fairly immune from, much more immune, I should say, from spurious actions by the medical board for that particular treatment.
Do they check with the FDA to see if you're doing some sort of a project before they come down on you? I mean, I've heard people, they just come into the office and confiscate their equipment and say, you know, we're going to take all this stuff, thinking about locking you up. They haven't put them in jail, but they're thinking about locking them up.
Okay, that's before I take your thing in, that's what we have to get into, where they do their Gestapo techniques, forgetting about INDs altogether. Let's say you're just a practicing physician, you're practicing dentist, and you've gotten a telephone call, you know, from those guys at the state or at the county level. At that point, right at that point, is when you should have either myself or an attorney to call and say, I want you to handle this for me.
What's your number?
I'll give it to you later on. I'll give it to you. I mean, if you want my number, here it is, 614-548, 614-548-4458. But at that point, you should, the first contact you get from them, you should be represented. You should have somebody else represent your case. If they call you in and say, we're going to have a hearing on you next week, you don't just set that day aside and, you know, cancel everyone on your schedule. You have somebody call up and say, what do you want to talk to them about? I mean, if you ask them, they usually give you some garbage. I mean, I've talked to a number of people who are massage therapists and chiropractors and dentists. They don't really tell you what they're going to bring you in for. You have a lawyer.
They're fishing.
They're fishing. You have a lawyer call on your behalf and say, you know, what's this all about? They can't say we're fishing. They either have to get something or pull off. I would say in a good number of the cases, just the telephone will get them off your back. If you try to handle it yourself, or you try to handle it with somebody who's not actually used to their tactics, or as I look at it, the reason I think you would want to go into a joint legal action group, or like legal defense fund group, is because you don't have to get, first of all, you don't have to shop for the lawyer. Second of all, you don't have to train the lawyer. You have somebody who's already shopped for it, who's already trained, and he's expert in the area. Because you're not going to get expert in an area by just handling one case, even if it wins the point. That's what's going to save you money if you decide to, you know, join into a common legal defense fund. Plus the fact, the plans I'll be presenting, the deluxe and the tourist class plan and the crisis plan. Each one you can determine, you know, how much you want to invest and what you want out of it. The crisis plan is just basically everyone deciding they're going to pull a couple $100 out of their pocket every so often and put it into a common fund, and then if somebody gets in trouble, like you get a call or something of that sort, you don't do it when you get the call, you go to the board, you don't do it there, and then when you finally get to the last stage, you know, when there's barely enough tooth there to save, you say, okay, crisis plan, we're going to pull all our money in and try to protect this poor sucker in court. You've got to have something, I'm convinced, you can't go with anything less than the deluxe plan. Yeah.
I'm still back at the front door of the FDA.
Okay.
And,
Was it locked?
well, it's open, and even without getting into the paranoid, just being perceptive, I can see one of the FDA people picking up the phone and talking to the people for the insurance and say, this guy's presenting protocol to us, he's always going to understand all that well. And so, therefore, these things are investigational and without license, so not accepted, and alerting the Board of Medical Insurance to send a shell in. I can see it happen, not anything further.
Tonight we're going to show a video of a tape, or highlights of a tape that Gary recorded at in Sacramento, a state subcommittee on health matters, and their topic for that day was professional competition. And the legislators are our friends. They made the Bumquat president, the attorney, and president of the California Medical Association do flip-flops. And one of the members of the board I told him, he says, you know, we don't need you. He said, we can go to a registration system. In other words, they can eliminate those jobs. So I don't know just what was going to come out of it tonight. Sharon Kimes, who's an attorney, whose husband is a physician, who's fighting legal battles because he does endpoint titration, a method of allergenic neutralization that opposes the standard allergists. They do some other kind of neutralization that takes forever, I guess. Anyway, they were arguing back and forth about that, and he spent a lot of money. And anyway, she's not going to be here because her dad became ill, but we can see there that there are friends, and all you have to do is basically maybe write them a letter and tell them what's happening, you know. And they're the people who put the pressure on. So,
yeah, there's all types of things they can do. I mean, the ADA for the longest time has had iron control of their legislators, congressmen, and the story is, you know, every congressman, every legislator needs a dentist. All right. Well, we can outdo them at their own game. I mean, I don't know how far you want to go, but you know, if you want to offer free dental care to the congressman in your area, you know, I don't care what it is. You know, you can do that. You can develop good contacts. But to get back to your question, if you are afraid of that, I wouldn't be. I don't think that's going to happen. But if you were afraid of that, you get somebody from your society who's never used that technique ever to apply for the IMD. I mean, that's the way you get around it. I mean, remember, for every
a new member, you said.
A new member. some unsuspecting, you know, dental school. Pardon?
But then it's in his name. What good will that do?
I know just the first.
Because under his name, the IMD will be under his name, but there will be a number of other investigators who will be working with him, those being you.
Free membership.
The person who's going to get the heat, if anybody gets the heat, I can't see why they would be the person who applied for that. Plus, with the IMD, you can put in a Freedom of Information request that you'd like to have monthly all records and communications made by them or to them concerning your IMD. That's done under the Freedom of Information Act. So you'll know exactly who they're talking to. Now this is where prevention pays. I mean, you don't wait until the crisis occurs and then get it by discovery through the court process.
How can you utilize the Freedom of Information Act as a dentist or a physician? In other words,
the same way you can as a biochemist or a janitor. You write a letter saying, I'm requesting the following information under the Freedom of Information Act. Send it to a person. If they're not the proper person, they've got to put it on to the FOIA officer in their agency. If you want to be a little bit more certain what you do, and they have to answer within 10 days. That's the law. They've got to answer you within 10 days. If you want to be 10 business days, that is, not including weekends. If you want to be a little more, how should I say, assured, you pay another 95 cents, certify the letter, and get a return receipt. If after 10 days you don't get it, you call up your congressman and say, this agency is in violation of the Freedom of Information Act, I want you to do something about it.
Does this apply to state agencies?
I believe the state agencies have a similar free information act. It's not called FOIA, but it's called something else here in California, because I think I have a couple of friends here who have used it for other issues.
So the government authority would be the FDA that you would be requesting information to or from of?
Yeah, as a matter of fact, let's say, for example, let's say we develop a legal defense fund. We get an attorney, or we get somebody like myself to be the science consultant to that person, or strategist and science consultant. What we would do is, you would decide that you want a IND. You give us the people you want on the study, the person whose name you want the IND under. We would go ahead and put the papers in, and immediately, as soon as we got the IND, we would put a FOIA request in to ask for whatever information we want to have. For example, any communications concerning this, we want to have this monthly. And we don't even have to argue why we want it. We could say we want it for, to keep aware of current comment on this particular subject. We could ask for, in addition to that, we could ask for any comments, whether it's regarding that IND or not, for anything we want, on electroacupuncture, on mercury amalgam fillings. We go to the NIDR and ask them for all their correspondence for the last 5 years on mercury amalgam. I mean, the sky's the limit on these things. And if you do it as part of a nonprofit organization like, say, Porter Foundation, they've got to send it to you for just their duplicating costs. They can't charge you for research.
We are a nonprofit organization.
Yeah, well, you can do it too then.
Who else can you ask that of? Like, can you get your licensing committee to do that? And
Oh, yes.
State Bureau of anything?
Yeah, well, I know the federal you can. In California, I'm quite sure you can do it with the state, yeah. The only thing they can refuse to give you is if you are under investigation by the police department or something like that. That becomes legal privilege for them. But nothing that they base it on is legal privilege. In other words, if I'm in the medical board or something like that, I provide information to the legal authorities, I can't withhold that from you. Only the legal authorities can withhold it from you because they're using that to develop the case. There are very few exceptions, and I don't have it now, but I'll send Ed Arana a little booklet they have on the Freedom of Information Act, the limitations and everything. The whole thing is this. It's like having, I think, the computer age that we're into right now, getting computers, is in some ways a plus, but in many ways it's a negative. Because each one of us then determines that we're going to become experts on the computer ourselves, and we waste our time. The idea is not for every single person in this room to become an expert in the Freedom of Information Act. The importance is to use the computer, use the facilities of the computer, and not waste your time. You want to do something else, and have somebody else who's familiar with FOIA. Maybe one or two of you want to start a study committee or study group on FOIA and present it to the rest of the people, that's fine. But to have everyone here become an expert on, seven different languages and a computer and the FOIA and IND and so forth, then there's no sense in having an organization like this. If you think there's something fishy going on, yeah, then you should get a copy of it, read it yourself. Yes.
Clarify something for me. If a instrument is okayed by the FDA as an investigational device, you don't need the IND, is that right?
That is the IND.
Huh?
That is called the IND.
That is the IND. And should you be reporting that sort of thing, do you say? If you're using it?
You don't have to.
You don't have to unless you get an IND. In other words, if you're doing something which may or may not be legal, with an IND, it definitely is legal.
I see.
In other words, something that otherwise might be legal or might not be legal. But when you get an IND and you submit the data, and it's shown that that's effective, then it gets FDA approval, and then it becomes currently accepted practice. which is a very important thing. When you do an IND investigation, you want to be sure that you're as honest as possible, because you may get something currently accepted that ends up causing harm to your patients down the road. So I mean, this is not a thing that you want to fudge. This is something you want to look into it and share the information that the other people who are working on the IND are with each other at your meetings and so forth, and finally say, yeah, or it does have these disadvantages and it has these advantages and so forth and so on. You got to be honest with it, because you're going to be stuck with it. The thing you develop now will become currently accepted practice and may cause harm to some of your patients.
Most of the time you see the manufacturer of these equipment pieces have this IND, but you don't know really whether you are under their umbrella or for sure. I mean, all they have to do is forget to put your name on a list, and you're not covered by this any longer. So you can yourself then apply for an IND with this same instrumentation, even though you're not the manufacturer.
Absolutely. I mean, you're the experts. The manufacturers are just a bunch of technicians and businessmen that want to make some money. They're coming to you as the expert. Without you, they couldn't do it. But you can do it without them. The only thing you need from them are certain specifications of their machines and so forth and so on. You want to make sure they have some safety tests before you got the machine. If a person like get electrocuted, or I mean, I'm not that familiar with a particular type of machine you're talking about. I mean, I've seen them at a couple of conventions, but each one of you could give me a lecture on it.
Yeah, that's what I was.
Yes.
What do you do with local medical harassment?
Give me an example, and I'll take.
Oh, the pediatrician and allergist that we work for is being harassed by the traditional allergist in town, and creating all kinds of problems. He's passing out information to his patients in leaflet form on the traditional approach rather.
You have basically, you would contact, the central group. If we had an attorney or myself, we'd contact us, and we'd have our attorney write him a very kind little letter saying, unless he ceases and desists, we'll take him to court. We can force him to cease and desist in court.
This group is kind of forming.
Right.
Because the pressure is really great on some people. They're out after them. They've got extra money, extra investigators. The heat's on. And this group is forming, and Bill Moore, who's an attorney, will be talking about that probably this evening. And they're going to ask you for money. So that now's the time to stand up and be counted, We've got to do something, or individually they'll just knock us all off, and that's the end of it. And it goes back into the dark age. If you believe in what you're doing, if you feel you can help people, and it all boils down to money. These people are threatening. It's the drug companies that are providing these funds, because they are economically threatened by this whole dissatisfaction with the medical health care system, which is a disease care system and not a health care system.
Now, to finish your question, what you basically want to do is stop him from doing what he's doing. That's number one. Number two, what you'd like to have him do is write a letter of apology to make sure that everyone he handed the other information to get a copy of his letter of apology. And with those two things taken care of, you're really not concerned what they do anymore, so long as they don't continue to do what they have been doing in the past.
Well, he's given information to the state board, the medical board. He's given information to the local health authority that takes care of the laboratory where we're working. All kinds of little bits.
Well, that's all right. I mean, what he does with regard to his medical board, if he wants to express his opinion, it's a free country. If I want to say, I think people over the age of 40 should be assassinated or something, I have the right to say as long as they don't do it. But what I would say in this particular case, if Ed wants to complain to the dental board about something the American Dental Association is doing, and he can call anything they want to, he should have that right. So should this other person. Now, if he's saying something that's untrue about the physician you work for, that initiates action by a state or local medical board against your boss, then you have a tort, a claim against that person. That person is interfering with this person's professional practice, and that becomes actionable. Also is actionable is if he would do anything that would tend to turn patients away from your employer's office. That is also a tort. That also involves loss, financial loss. That is actionable. And if the case looks good enough, quite frankly, I would say that whoever you have as a legal defense, I hate the word legal defense fund, I would just say it's called legal fund, because I think most of the actions we should do is be an offensive fund and go in there and sue them for $500,000 or $500,000, $200,000, whatever damages you think you can get plus punitive damages. Because by example, you know, so many people on our side have been so intimidated they're afraid to do anything. Yeah.
Well, a big point that I see is the ADA's principle of ethics stating that it's wrong for a dentist to tell a patient that the mercury in the silver amalgam filling is toxic to them, okay? You're not supposed to say that. In other words, they're asking you not to tell the truth under penalty of chastisement of some kind. In other words, shame on you, you're a bad boy, you told them the truth.
That's fine. I mean,
Now, what do you think about that, David? I mean,
so, you know, there's something called freedom of expression. You have the right to express your opinion. Now, the whole corporate scene I don't like at all, especially when ADA says, well, ADA doesn't say anything. ADA is a piece of paper that's on file, I guess, in the state of Delaware or state of Illinois or something like that. All of this is a corporation. Somebody is making that statement, and they're putting this corporate cloak around them to make themselves invisible. But if ADA says something, it's going to carry some weight, I imagine. If ADA says, you know, these practices Dr. Aranda locally here are just nothing but quackery, there isn't too much you can do. You have to bear that. And then Dr. Aranda can say about the American Dental Association. The American Dental Association is allowing people to be poisoned by mercury. There's nothing the ADA can do about that because that's your opinion. I mean, you're out in the battlefield. There's some places, I mean, I think we have too many laws as it is. These are situations where the only way to do things about what ADA says directly is in the open place, in the open marketplace. And this is where I think when I talk to you about the fluoride stuff that we're doing, you'll be quite encouraged to hear that ADA is, if it keeps up the way it's going right now, by the end of this year we'll have absolutely no credibility at all. We're going to be taken over the coals by the establishment press, which has been a part of it for so long. Yeah.
Playing off of this one here, we have two organizations, the allergists, and anyway, they've got control of the press. And they, in our medical literature, they're editorializing against environmental control, environmental illnesses, against what the so-called ecologists, etc. They've come out very strongly against Billy Crook and his treatment of the yeast program, etc. And though I've seen long letters sent back to the editors, and I indeed have sent these same letters back to the editors. They don't get published. We get no published, no acknowledgement. There's a senior editor of the AMA.
It's what they call freedom of the press. You know, they have the right to do that.
Yeah, they have the right not to publish. So how do you expose that?
How many people? What journals are we
have
talking about now?
Well, we're talking about showing that they're grossly unfair in what they're reporting.
Well, where are they reporting?
In American College of Allergy, their journal, and in the Annals of Internal Medicine and JAMA. All of these things have contained carefully worded editorial things for the first time ever in their history about a branch of medicine.
So what you want to do is go with a journal that will publish.
Like Newsweek.
I have an answer for you.
Okay.
Bill Moore is an attorney and a physician. They have a journal of quantum medicine, and it's a journal of comparative therapeutics. And they have a double issue, the first one, come out, looks like a paperback book, but in there I'm sure you could get, if you want to write an article about what the problems are and state it as you see it, I'm sure they'll publish it. And it's peer reviewed by all of the people that are discontent with people not giving them say in their other kind of journal, you know.
Well, how many people here
So,
read?
in other words, we'll make that the journal that everyone should read, like New England Journal of Medicine or Lancet or something like that. Or Focus.
Focus, there you go.
Focused. They're a little slow in
But
coming
you've got to
out.
ask yourself, how many people here read the Annals of Internal Medicine regularly?
I'll tell you the
No,
attorney.
no,
Okay.
wait, right here. How many
Okay.
people read the Annals of Internal Medicine regularly? Okay. Now, that's about as many as people as, there might be more people who read the Journal of Quantum Medicine or something like that. Is that what it's called?
Yeah, I don't think anybody reads it.
Okay.
They don't even know about it.
But the whole thing is, it's not the fact, that you're moving public opinion by the Annals of Internal Medicine.
I've been,
But there are other very subtle things that you don't appreciate. Because these very same articles are now being used against me when I'm giving testimony about people who have been damaged at their workplace
Okay,
at
fine.
General Motors and
Fine.
at AT&T, et
Fine,
cetera.
so you have an article in Journal of Quantum Medicine. What is the court going to know the difference between the two? Believe me.
I see.
But you have your own journal. But let me tell you something else. If you want to influence public opinion, unfortunately, there are journals that do influence public opinion. One is the New England Journal of Medicine. I'll tell you something about the New England Journal of Medicine. I used to be an editor for chemical abstracts, biochemical editor. My job was to actually edit summaries of 1/10 of all the world's literature from every single journal in the world that was published. And it was quite a, eye-rubbing job. It was just not my field. It was the entire field of biochemistry. And then re-edit probably, actually about 30% of all the world's literature went through my head in summary form. I'll tell you something about the New England Journal of Medicine as far as accuracy goes. And this is the nice thing about having me there. If somebody uses the New England Journal of Medicine against you, I'll take a number of articles out. For example, there was one, last December, saying that you got to be careful about the water that you drink because it doesn't contain enough fluoride. It came, by the way, when something appears in the New England Journal of Medicine, when they sneeze, Wall Street Journal picks it up, New York Times picks it up. It was in all these things. You have to worry about it. Thank goodness Perrier is the only water you can drink. It contains 1.9 parts per million. This was New England Journal of Medicine. So I remembered analysis we had done at Safe Water Foundation, and as I remembered, they were about 0.2 parts per million, fluoride, Perrier. So I contacted our chemist at the University of Kansas. I said, Al, he owed me something. I said, Al, you remember that thing you owed me? I said, well, you don't owe it to me anymore. I want you to pick up a bottle of Perrier off the shelf and measure the fluoride concentration. In the meantime, I called Perrier. Well, the results Bergstall came up was not 1.9, but 0.19 parts per million fluoride, which was one of the lowest waters they tested, and they were telling you, this is what you should drink to make sure you get enough fluoride, because, and Perrier got back to me, they said it varies from 0.14 to 0.20. Then in the article they said 1.9, which is within the range of 0.7 to 1.2. This is 1.9 is within the range of 0.7 to 1.2 parts per million, recommended by the EPA. Well, the EPA doesn't recommend any level. They set a maximum contaminant level, and that's 4 parts per million. Now all these mistakes were in an article so small that you wonder if there was anything left for a the or a period. Now, this is just one. They had another one about my cancer study done by Dr. Erickson by the CDC. Absolutely abysmal. And we had him and his article in a court case that we were involved in. And we just totally decimated them. I have the records on it and so forth. So if they bring New England Journal of Medicine just as a name against you, I'll say, I read the Journal of Quantum Medicine. I'd have to read it. I have to read some issues. And I'll say, if you want to compare the two, I read the Journal of Quantum Medicine. I found nothing as abysmal as some of the things that appear in the New England Journal of Medicine. So you can't use the journal title itself to imply that something's good. New England Journal of Medicine is one of the most rock-gut journals that I have read. JAMA I don't read that much because it is so unesoteric and so political that it's usually about 3 years around before it gets into JAMA anyhow. And I don't want to read things, I don't want to read the last week's newspaper. And then Lancet, although it may have some good articles in it, I had an exchange with Lancet where somebody again did some studies trying to claim that, there wasn't a link between fluoridation and cancer, as Dr. Burke and I found. I wrote a letter to the editor pointing out we had congressional hearings showing the data for the so-called independent study was actually shipped to them by the National Cancer Institute, was found to be erroneous by us, and they went ahead and published it in their journal, pretending it was new data, and they didn't want to print it. And I said, well, how much do you charge for advertisement? Because I want to put an ad in your journal. and by means of really pushing hard, we got that letter and a follow-up letter into Lancet, and they hit them pretty hard. Nature was another one. On that one, I just gave up because, as far as I was concerned, Nature wasn't worth it. Now, we have situations where they're writing news articles about us, but again, I'll get into that later. We can deal with these things, and this is why I think that if you get myself teamed up with at least one crack attorney to start off with, maybe as we grow 2 crack attorneys, that I can come as an expert witness. I can do expert witnesses for you with good credentials. I'm not talking about shabby ones. People I'm associated with, the dean of the graduate school, dean of graduate school at Cornell University. I guess he's dean of postgraduate research. Is a personal friend of mine. And we bring top names in like this, and they can't bull over with credentials anymore. And that's the only thing you're concerned about. Now, there's 2 ways of dealing with this. It's like the Republicans, Democrats. I was asked, well, what should I vote, Republican or Democrat? I said no. Both parties to me are so bad that it's much better to start, with an independent candidate. And this is what you might feel. You might feel that all the journals out there are so just abysmal that you want to start your own. Now, there are some that have actually come to me. Remember, should I get into some of the fluoride stuff, or should I get away from that? Let's continue with this. Let's continue with more of the things, because the fluoride stuff, I tell you, will have direct pertinence and let you know what we can do. I mean, just the impossible things that we're able to do if we just walk in the front door and work hard. There's so few people working hard today that it's easy to win, because all you have to do is work hard and walk in the front door, and you've done it. Yeah.
I wanted to ask a question a while back about state boards. State boards claim that they don't, I can't remember what it was, but state boards claim that they do not follow the ADA or its recommendations, and yet everything they do, they back what the ADA says.
Why?
Well, like for example, I have a case right now.
If there was a pool of blood dropping from the ceiling there onto the floor and making a puddle, and the puddle started getting bigger and bigger, and it started moving towards your foot, and you don't want blood on your shoes, because it would stain them or something of the sort, what's one of the first questions you'd ask? Where is it coming from? Where do the people on the medical board or the dental board come from? How are they chosen?
In our state, they're chosen by the governor.
Exactly. Now, why would the governor choose those particular men? Who recommends those men to the governor?
Other people.
No.
The
Medical Association.
Medical Association. Now you want to know why?
Well, the dental association in this case.
And the Dental Association for the dentists, the Medical Association, and sometimes it's written in the law. It's written right in the law. The governor shall consider nominees by the American Bar Association, for their crooks, the American Dental Association for their crooks, or the state affiliates, and anyhow, that's how they're chosen. What you've got to do is you've got to get in there and remove. I had I think I still have a constitutional amendment to remove the name of all private groups, corporations, profit or non-profit, from state law. I mean, that's the thing, right? Which is one thing, just one amendment to the entire laws. It all means that the entire statutes would be stripped of any reference to the American Dietetic Association, Dental Association, ethics of this and that and so forth and so on, Bar Association, all of it comes out. Now that quite frankly would be, how should I say, a cleansing of your statutes. It would avoid a lot of these problems. Another thing, it doesn't say that the governor has to choose the people who are suggested to him by these various associations, which means, again, that if you have a group like this, or if you have a legal defense fund. And the legal defense, I'm talking deluxe plan all the time now, is they would go ahead and get you organized and have a meeting with you, with the governor, with your suggestions of who you'd like to have on there, so that you at least get some of your people on there. I mean, you know, this government is supposed to be ours, and just because there's so many crooks in it right now, doesn't mean we have to let this thing continue. Because if we do let it continue, we're going to have the same problems. Again, it's like a toxic, a low-grade infection in the body. As long as you leave the infection staying there, you're going to have problems. You're going to have to eventually get rid of that infection. Now, you can get rid of it by means of maybe silver ionophoresis or something else, or you might do it in the end, getting a healthy government and getting the crooks out. You want to do one step at a time, and I think the first thing you want to do is start introducing legislation, pushing for it, and then second of all, you want to meet with the governor and present, while he still has to consider these other yo-yos, you want to at least tell him why you're concerned that the board not be dominated by nominees who were nominated by the American Dental Association, and then bring out certain points. Well, here's what they said about mercury, here's what they said about fluoride, here's what they said about this. Things that they have been shown wrong. And, you know, while you might want one voice on the board, you want the rest of the board to be, you know, independent people. You go back into the thing, and currently accepted practice might be great for you know, 10 years ago, but right now we need things to improve healthcare.
My question is, what changes currently accepted practice?
What changes that?
One of the things that they brought out was that, hey,
A patent, maybe.
no.
A
they
patent by a
said
drug company.
There's no scientific evidence showing, for example, that mercury is toxic or that it comes out.
Who
in the
says that?
mouth. This is what the board was showing.
Oh, well, then.
Okay.
No, no, no.
They're saying there's no scientific evidence pointing to that.
Well, here again, Terry, you've got to be prepared. My God, that their BioPro is handing you a lot of research, like on a platter. Just go through all of that material, go through all of the references that they have, and they've got, Matt Hansen's got a new 8,000 reference bibliography.
Have you seen this in FASA?
What, is that Vimmy's new thing? Yeah,
December.
well, all of these, I mean, the preponderance of evidence is so anti-mercury, anti-amalgam filling, that it's in, I don't even see how they can hold their head up.
But the
I mean,
point-
they're hurting people.
The point is that they don't recognize it. I mean, here's the FASA journal. It represents 31,000 researchers in North America,
Okay.
published by PhDs, by a editorial board that has 4 Nobel laureates. I mean, what's scientific?
Wait a second. We're talking about the Federation of Applied Sciences and Experimental Biology. That's what FASA stands
Federation
for.
of
Yeah.
Society of Experimental Biology, right?
Yeah,
Right.
right. All it is an association, that's all it is. And there are a lot of people who belong to that who don't believe the articles that are put out in every journal. I mean, there are going to be things that are published in BioPro that you may not agree with. This always happens. Just because it's published there doesn't mean that 31,000 scientists and 4 Nobel Prize winners believe that that's the case.
Well, that's the question. When is it accepted as scientific evidence? Who says, okay, this is it?
The point
community.
is, the word accepted scientific evidence is what they call oxymorons. It's inconsistent. Science is, the nature of science is such that it always changes, so it can never really be accepted at any time. All you can say, these are the best indications that science can give us at this time. Pardon? Oh.
Well, I thought Sweden, didn't they ban mercury?
From what I understand, they're phasing it out, I think.
Yeah, well, January 1st, 1991, there'll be no more amalgam, silver mercury amalgam used in Sweden as a dental filling material. And they're going to have environmental police to go and check it. And the problem they're dealing with now is how to treat these patients that have been injured by this stuff. And that's the problem when we get it here.
Right.
My God, what are we going to do? I mean, the insurance companies will commit suicide.
That's right.
You know.
Well, if they accept that it's harmful, you know, amalgam's been placing patients over the years, you take it out all at once. And if they accept that premise, then Just come help out.
This is a good chance to bring this up. I'm sure most of you know about the International Symposium on Mercury Fillings that's going to take place in Raleigh, North Carolina at the state legislature on March 31st, I believe it is. You didn't know about that? Well, it has all the earmarks of a real happening. They've got every environmental group there. They've got, I don't know if they got the governor of North Carolina, but they got state legislators. And they got Sandy Denton and Huggins and Mike Ziff, and they're going to talk. I don't know how they're going to get everybody on the program, but it ought to really be very interesting. Like things have been going on in Alaska and different states, and Arizona. You know, talking about this. The more consciousness you can get, the better it is. It's the 100th monkey, the 10%, and then the whole attitude just changes overnight. So we have to work on that. So any way you can do it is fine. I mean, write a letter to your editor, you know. Say, well, I don't want exposure. Well, now's the time. You're going to have to get exposed sometime, or you're not going to be doing biological dentistry.
Right.
Now's the time.
Sandy Denton has a really good letter that she wrote to the Board of Dental Examiners in Alaska, and it just reamed them out for their unethical approach and not looking at the research as far as what's going on.
Well, I'm not familiar with that letter. Send me a copy. It's like, Fuller Royal just wrote a
Yeah,
paper on the, is dentistry contributing to our chronic ill health? And the answer is yes. And he goes through the whole thing. And he sent the letter to the ADA and the, half a dozen different journals, and we'll publish that. And if I can find a copy, I'll have it all made up, and we can pick it up tomorrow. Everyone's talking about it.
Yes.
I was going to comment here because for you to get with fluoride as far as you've gotten is totally amazing to me. And we're talking about mercury as a problem. I would think that mercury shouldn't be any more difficult than fluoride was. Maybe even
It'll be
less.
far less difficult.
Oh, we could show them with their pants down on the fluoride issue after a lot of good work and a lot of time and money on your part and other people's part. Well, you can just say, well, this is it here. They're changing their attitude. Now the establishment is mad at the cancer people that came out and said about diet. You know, in other words, what, 5 or 6 years ago, they finally did the flip-flop and said, well, those yellow vegetables, those green vegetables, the beta-carotene, on and on. In other words, it has some component of protection against cancer. And now they're mad at them for saying that. It's just like the people come out against oat bran, you know. They're flip-flopping back and forth. And the oscillations will get greater as the thing starts to fall apart. You know.
All these things have to be considered. Now, I came primarily to speak on a legal fund that would help all of you maintain your practices, take these guys off your backs. But I will say, along with that, I and wearing other hats, am involved in public relations, and I can tell you, I know that what we see on just the top, this flip-flop on oat bran, the thing that diet is important for cancer now, and a lot of people are saying it's about time they realize that. Don't realize the establishment has other things in mind. I was talking to Erwin Brose, who is a consultant of mine as far as statistics goes. I run my things by him as sort of a check. Erwin is the former chief biostatistician at Sloan Kettering Memorial Institute, who was also chief biostatistician after that at Roswell Park Memorial Institute. He's just recently retired about a year or two ago. But he's one of the top biostatisticians in the country, and he points out the reason the establishment is beginning to go to this diet thing and saying this is what the cause of all our cancer is because they're trying to cover up what environmental hazards are doing in various parts of the country. They want to take the heat off. They want to take the heat off polluting industries that are causing lung cancer and stomach cancer, etc. So some things that look like they're blessings. It's nice to know there's somebody who's keeping track of all this. We do know pretty much what's going on underneath the whole situation. I wish I had a copy of my book, High Performance Health, here, because that covers it a little more widely. Yes.
Well, this opens up the whole thing. Robert O. Becker lost his position at the VA as a researcher, mainly because he was complaining about electromagnetic pollution caused by the people in communications, and Navy especially, the Department of Defense, they came down all over them. And there's a new, I guess Paul Broder's got a new book out. The guy that wrote The Zapping of America about electromagnetic pollution. Our little bookstore has the BBC tapes that you won't see here about electromagnetic pollution. There's 3 in the series and 1 on electromedicine. Becker's got a new book out on cross currents. These are all information so that you can see what you're saying is absolutely the truth. And the whole idea of detoxification, if you pollute yourself, you have to clean yourself up in order to regain your health. Well, they're going to fight that tooth and nail. Do you think they fought about mercury? My God, some kind of health, natural practice idea that's going to go. That's a war. I mean, and that's what's going to require. We have to enlist people with money to support this kind of thing, and go ahead. I mean, this is the time. Go ahead, John.
Now, yeah, let me go if I can. I'm gonna hit the, what time do we have right
I'll get about 10:15. We'll go about 5 minutes more, and then we should take a short break. Yeah.
now? Okay, we can go about 10, 15, or can we go 10 minutes? Or?
10 minutes, all right.
Okay, because what I'm going to do right now is I'm going to go into the fluoride a little bit, because I think this is a good part for it to come in. We're talking about impossible things. Now, probably if I were to start working in the health rights fight, just for health rights, health freedoms and all this, fluoride would have been the last thing I would have looked at. President of the National Health Federation, former president of the National Health Federation, who was one of my mentors, Charles Facilities, used to relate a story. He said to me, if you went down a hallway and the idea was to find something or to spread the word to as many people in the rooms off the hallway as possible, you get on the hallway and you don't try to break down a locked door. If the door is locked, you go on to the next one. You do the easiest things first. Well, fluoridation obviously would have been the hardest thing you could imagine, because here is something that has had history now being added to the water supply for 45 years in Grand Rapids. It has the endorsement of every major group. It is one of the 4, how should I say, pillars of public health, which are chlorination, vaccination, pasteurization, and fluoridation. It is really the hardest nut to crack of all. When I was involved in the nuclear issue in California, I was one of the co-speakers with Ralph Nader at the large Unitarian Church in Los Angeles. We were talking for about 45 minutes because I knew several years before Nader had come out against fluoridation, and I had to shut up about it. And I said, why? He said, whenever I bring up the subject of fluoride, the press cuts me out. I don't get any press for 3 months. This is a person as strong as Nader is, with all his charisma and power. And he said, and I've got other things I've got to deal with, so I really can't handle fluoride. The promotion of fluoride was done very carefully. The people who were opposed to fluoridation were painted as right-wing radicals. I mean, there was this libertarian, non-libertarian, libertarian versus socialism at the time. And it was very easy for the PR people of the fluoride movement to paint everybody who was against it in with these people who just were against it, whether it's good or bad, because it was some type of socialized medical care or something of that sort. And it has carried that thing through for decades. So we had a bad name, everything was going against us. Well, how I got involved in it, I worked for the American Chemical Society, started in 1968, a number of articles started crossing my desk showing harmful effects of fluoride. In 1969, I wrote a guest editorial for the Columbus newspaper, and all of a sudden, the Dental Association, Dental Society sends letters to my boss to fire me, the Public Health Service, and I couldn't believe what was going on. In 1970, I was told by my employer, we've been threatened with a cutoff of over $1 million in federal funds if you not shut up. So it's either you shut up or you're going to have to go. And there were no battles at the time. We just defeated fluoridation in 36 out of 39 towns in Ohio. And my job was basically over as far as the campaigning went. But when I did next speak out, I was called into the office and told, we're not going to fire you, but you're never going to get a raise here. You're never going to be transferred to any other department. You know, we're gonna just sit and watch you die on the vine. Well, that was 1972. I'll tell you what happened between them, but I'll just show you some of the results. This is August 1st, 1988. 17-page cover article in the American Chemical Society telling its readers the same thing that I was forced out of chemical abstracts for, which is the largest division of the American Chemical Society. By the way, while they pointed out persecutions in this journal, they didn't point out what they did to me, but that's all right. This started the whole thing going. Now, I will have some handouts here.
Maybe somebody can help pass this out. Get the right one first.
This was followed by,
Oh, no, tell me.
again, this was followed by a journal. Actually, how many people read Medical Tribune or ever read Medical Tribune? It's followed by an article in Medical Tribune, which I'll be passing out. Probably what I ought to do is pass these out. I've got to fill in the history here a little bit. In 1974, 1975, Dr. Burke and I began studies looking to find whether there was an increase in cancer death rate in fluoridated versus non-fluoridated areas. This was not a shot in the dark.
Do you have more of these?
That's all I have.
Well, we'll get it made up.
Okay.
So
I have plenty of
those
the
are
other
you
ones,
don't
but
get
this is, I'm limited on these. This is all I have of these.
I'll
This is
take one and we'll
in
get some
December
copies made.
28, 1989. But I want to give you the history on this. Anyhow, between 1960 and 1985, 1980, there were about 40 articles showing that fluoride at levels down to and including the amount used to fluoridate public water supplies caused genetic damage, meaning it was mutagenic. In 1963, some top researchers, Drs. Herskowitz and Norton. Herskowitz has written about 9 texts on genetics, found that fluoride was tumorigenic, actually caused an increase in the incidence of tumors.
What year was that?
1963. The study was supported by none other than the National Cancer Institute, and was sort of sitting hidden there until we brought it out. In 1965, Drs. Taylor and Taylor at the University of Texas showed that 1/2 to 1 part per million fluoride actually increased tumor growth rate by 15 to 25%. These are the studies that led us into our work to see, okay, if these studies are true in the laboratory, can we find evidence in humans? And as a matter of fact, we did. We found that fluoridation of public water supplies amounted, after demographic corrections for age, race, sex, etc., accounted for 10,000 or more excess cancer deaths yearly in the United States as of 1970.
Is this a teratogenic influence?
This is apparently, it seems to have one or two or both effects. Number one, it causes a lesion. In other words, it causes the break in the genetic material. Number two, it can work along with other carcinogens because 1 part per million, the amount they add to public water supplies, depresses the DNA repair enzyme system by 50%. And a number of the people who have since written have confirmed my hypothesis. They say the effect of fluoride on the way it is a mutagen is because it either affects DNA synthesis or repair. Now, these were all studies that were done before we even began our studies. So we began the studies, and we found 10,000 excess cancer deaths per year. In 1977, we presented our findings to Congress, and I have the congressional hearings here. But basically what happened was we showed that the National Cancer Institute, in trying to cover up the fluoride cancer link, made an error. When their error was corrected, their findings came out exactly the same as ours. They actually made a mathematical error and they left out 90% of the data.
That's not an error.
And that was what we call an omission.
Premeditation.
Yeah. And when the errors and omissions were corrected, they also found the same thing, 10,000 racist cancer. Now this, you know, you don't go through congressional hearings and so forth, but in my book, Fluoride, the Aging Factor, I have this detail. We actually have the documents, which we obtained during the congressional hearings. They said we never sent anything to the British investigators. As a matter of fact, the staff of Congress went over and rifled through their files and got the letters, and those letters are reprinted in my book out there, Fluoride, the Aging Factor, which I'll be talking about later on. So, in 1977, Congress mandated the studies be done just to make sure what we were looking at wasn't due to some other extraneous influence. We had to show that fluoride was definitely carcinogenic. The studies were supposed to have been completed in 1980. They weren't. In 1979, I met with Dr. Arthur Upton, who was then director of the National Cancer Institute. He said, Dr. Yiamouyiannis, you're going to be on the protocol committee. Well, this very day, I have not heard a thing about being on the protocol committee. I didn't like the protocol. I thought it was very unfavorable to finding anything. But they went ahead and did their own protocol without the evil influence of Dr. Y. 1984 came. They said, we have the results of our study, but they're no good because rats and mice all over the place were dying, even in the control group, and we couldn't keep the animals properly fed. And that cost about $3 or $4 million. So as a reward for that bad research, they were given another $5 or $6 million to repeat the experiment. The experiment was repeated. I think the last animal was killed in 1987 or 88. And they were under pathological examinations and reviews and so forth. I cannot believe, I mean, no business could ever work like this. They have about $10 million into the study. And I will also tell you that since 1985, I've been working as a consultant to the president of the Union of Professional Workers and Scientists at the Environmental Protection Agency. So if you want expert witnesses, I mean, we've got them. We have them showing that their own management is lying. And they even filed suit against their management a couple of years ago on the fluoride issue. I mean, so I mean, things, we have a nice pot stirring here. It's smelling good. It's getting well brewed. Anyhow, he told me, he gave me a call in last fall, and he said, John, he said, one of our high-level bugs has told us the American Water Works Association just had a meeting with the director, Riley, or Riley's assistant, I'm sorry. I forget, his name is Hovicht, Henry Hovicht. And that during the meeting was discussed the fact that fluoride was shown to be carcinogenic. So we went through the FOIA, Freedom of Information Act, very useful tool, and I badger people. I go for blood. I mean, I really do. I love it. I'll never be a vegetarian, I don't think. Many people won't like me, but I really go for blood. And I went after these people, and after these people, and after these people. Went to Congress. Tom Foley is working on it with us now, who's the Speaker of the House. Unfortunate thing about congressmen is they're not too bright. So, it's true. I mean, you can't help it. So you got to keep after them. You got to keep simplifying them to the staff, to them.
They had too much dentistry done.
Too much mercury. If somebody's from Spokane around here who's a dentist, yeah, why don't you see if you can take care of Foley, okay? Get him out of his mouth.
Yeah.
He's from Spokane, isn't he? Yeah.
He put it in.
You put it in. I'm going to take it off now.
Hey, put that gold crown on top of it. Drive it in there.
Needs to be detoxed.
Anyhow,
He goes to the local president.
The society, there you go.
anyhow, we found out, we got some leads. I contacted my friend at the EPA again. We got down to something called the National Toxicology Program. We knew they were doing a study. We were asking, is it their study that showed these? He said, well, there was a Procter & Gamble study presented to us, which, by the way, has not hit the media yet. It's going to, and I'll tell you about that. There's a Procter & I'm sorry. I think, should I continue this after the break?
Finish up what you're the point you're going to say, and then,
Okay.
because my tape's out.
Okay. Okay. So we finally got the Procter & Gamble study on carcinogenicity. Every single test that they used showed that fluoride was positive in a dose-dependent manner. All the tests were positive for cancer in the Procter & Gamble test. It was submitted in 1985 and kept under wraps all that time. We pushed on the National Toxicology Program, forced that out, and that's what you have on that yellow paper there. It says, what does it say, fluoride linked to bone cancer?
Yeah.
That's the first thing now. It has been linked to oral cancer, and the data is still not all out. It's coming out slowly, piece by piece by piece. As a result of that, how many people have heard of Science Magazine? How many people haven't? One person. It's probably, I think, the most prestigious and largest general science journal in the world. And if you hand this out, this is what Science. Now Science, in addition to the fluoride cancer, pointed out a study which I'll be talking to you about maybe this afternoon. Is a study we did showing that fluoride doesn't reduce tooth decay. It's the largest study ever done in the history of this country. 40,000 school children, age 5 to 17. That is written up in that in the Science article along with the fluoride. And then somebody else would just like to pass out. This is the Newsweek article. Don't drink the water. Coming out a little stronger. And the articles will be coming out more and more strong as more of the NTP results are released. In the midst of all of this, what do we have from the American Dental Association? Quite frankly, I may be passing it out there. Make sure when I passed out, you don't pass out the press release from the American Dental Association. Seriously, I think you guys have it. Or do I have it here? Okay.
This is don't drink the water.
In the midst of all this now, where fluoride has been shown, and I have to go over the study really quickly. Again, through the Freedom of Information Act, we got the data from the National Institute of Dental Research. We did a dental survey from 1986 to 1987 of 84 areas around the country, showing 5 to 17-year-olds, broken down into equal groups in every area, being about 30 or 40 children per group. And we found, I should say, about 29 were never fluoridated for the entire period of time, 28 were fluoridated for the entire period of time, 27 were partially fluoridated. If you take a look at the backside of the yellow sheet, medical trivia, and turn it over, you see the graph there? You'll see the graph in the Scientific American article. You can see in every single age group there was no difference in tooth decay rate. That was published in Chemical Engineering News again. We're not talking about the Journal of Quantum Medicine or something like that. A lot of people read this. A lot of people read this. A lot more than read Annals of Internal Medicine.
Good.
Yeah, really.
One thing I can't figure out yet is where's the money? Who gets?
Well, let me finish that.
Who's behind
Let me get the punchline out here. This is where the American Dental Association comes. Now, you got to realize, we have since gotten on our side the National Resource Defense Council, the one who blew the whistle on ALR, Jackie Warren, spoke on our behalf on CBS Evening News, saying that it's harmful and it doesn't even reduce tooth decay. I mean, you got the largest environmental group. And against her was, what's that lady's name? She's a lady who looks like she was taken off the set of Hansel and Gretel, but she wasn't Hansel or Gretel. She was the one who lived in that cookie house.
You mean in ADA?
Yeah.
That's Edith Liddell.
Edith Liddell. And I'll tell you, if I was their PR man for the American Dental Association, I would hang myself for putting her on the air. She was she really looked bad. And she was blustering something about, oh, they shouldn't be coming out with this data showing that fluoride causes cancer. They should keep it quiet and do more research on it. I mean, just looked horrible. And here's what they come out.
How did you like her dentures?
I didn't even notice them.
Oh, I made them.
You did? I'm glad I didn't comment. Anyhow, here is their statement. In the midst of all this, what is the response of the American Dental Association? First sentence in their press release: water fluoridation remains the safest, most effective, and most economical public health measure to prevent tooth decay. Okay? This is why CBS News won't even talk to the American Dental Association anymore. Now, you want to talk about media coverage. CBS News is a fairly big network. It's one of the major networks in the country. We've gotten on CNN News, we've been on ABC, we've been on NBC. I think Time is going to be picking us up, I'm not sure. And what's most important is in the next issue or two of Medical Tribune, the new studies from Procter & Gamble confirming the National Toxicology Program studies are coming out. In the meantime, and I'm ending it at this, I'm going to be asking if anybody wants to help us, because I'll tell you, we're doing a hell of a job. We're a tax-deductible organization, you know, and if you want to make donations, I'll suggest a $100 donation for every one of you, and those who think that's too paltry can increase it. But I'm very serious. Winning this is crucial to us at the time, because if we don't win this issue, which by the way has been on the books for 45 years, if they can overturn us on this, we're all going to be in trouble. And so I'm saying a donation to us, which is tax deductible, will be in your best interest because it'll help us out. It'll help me with some of the things I'll be proposing this afternoon to you as far as your legal defense. But I would like to say there's no question that we could not have taken on a more difficult job than the defeat of fluoridation. And I'll also tell you that if we leave it sitting right where it is now, we'll lose. It's got to be pursued vigorously, and by July 4th, 1990, I'm off this project entirely. I hope to have fluoridation stopped throughout the entire United States. Thank you.
Where does the money come from? Who the hell gets rich on having fluoride in the water?
Okay, in my book, Fluoride, the Aging Factor, which I hope you all get a copy of, I'll autograph it for you, whatever it is. $7.95 retail price, but we have it at a special price of $8 because we're out of nickels. But for 5 cents, I'll sign your book. I mean, you can't. All right? But I want to take a quote out of the book because it answers this question pretty well. And this is what started the whole thing in the first place. It says how they pollute. The first quote I take from myself, which is the garbage truck has to stop somewhere. It is an industrial waste product. But here's what Rebecca Hammer, Deputy Assistant Administrator for the U.S. Environmental Protection Agency, said March 30th, 1983. In regard to the use of fluosilicic acid as a source of fluoride for fluoridation, this agency regards such use as an ideal environmental solution to a long-standing problem. By recovering byproduct fluosilicic acid from fertilizer manufacturing, water and air pollution are minimized, and water utilities have a low-cost source of fluoride available to them. What she's saying here is if our phosphate fertilizer industries couldn't dump their waste product into our water supplies, phosphate fertilizer would no longer be, and it's true, phosphate fertilizer would no longer be a suitable alternative to spreading manure back on the ground again, which of course would clean up our waterways and stop all the runoff from farms. We'd be recycling the minerals in the biosphere back into the ground again. This is what keeps them going. Keeps them going and also concentrates wealth in the hands of a very few.
And who are they?
Who are they? Well, in this case, they're the phosphate fertilizer manufacturers, but they include your friends, the bankers and insurance companies that help you along your practice so much.
The bankers, the aluminum industry,
Yeah.
those people. We're going to take a break. Let's get back at 11, and please visit the exhibitors.
Oh yeah, I'll put my phone number down here. If somebody gets lonely, somebody can give me a call.
Get started.
Do you do radio shows?
Yes, radio and television. I know that. I was there. Yeah.
They just passed it?
Well, the point now is with the information we're getting, we can move. Are we all back? Or most of us are back? I guess I should start. Okay, I briefly went over the fluoride issue to give you an idea. Of what can be done with what looks like something that's almost impossible.
Can I ask you about it still? I have never yet heard about or seen a study about the fact that fluoride is not carcinogenic efficacy.
Okay,
Do you
fine.
have something like that?
Yep.
And you know what bothers me is I graduated '82 from UCLA, and we were told that there is nothing in science that is more documented as far as studies, epidemiological studies, that fluoride prevents tooth decay.
Well, let me finish the rest of the American Dental Association press release.
Yeah.
Okay? Because this is exactly what they say. Now, this is after the Public Health Service, which is a major promoter of fluoridation, is now finding that fluoride is carcinogenic. I'll read their press release and show you the difference between their press release and ours, and why they're going to lose credibility. In Chemical Engineering News, which is on the other flip side of the Medical Tribune, is a tooth decay study. It's a yellow sheet. Yellow.
Yeah, we got the white one.
Oh, you got one? Sorry, you got the white one? Sorry. All right. And Chemical Engineering News is the official organ of the American Chemical Society. It's the largest or second largest, I think it's the second largest scientific organization in the country. Science Magazine is the largest, and it appeared there also. You have a copy of the Science Magazine article as well. Now, the fact, you're a medical doctor or a dentist?
I'm a dentist.
You're a dentist. The fact is that we are not reading some of the things we should be reading. And maybe some of these articles should be published in dental journals. We had submitted, do you read a journal called Community Dentistry and All Epidemiology? No. Okay. There are so many, the Journal of Dental Research, all the time. So an article can get in there, and you wouldn't read it anyhow. The average dentist doesn't have the time to even go through their own, let alone general science journals. So what is necessary, and I hope that the group does, is take abstracts of very important things, very important articles from around. I mean, the whole group reading, and then just taking summaries or abstracts of these and reporting them in the little bulletin, things that are important to all of you, things that you should know. Yes.
I'd like to add it at this time. Our journal, we have a 16-page article coming out on networking, and we're going to do online networking, probably start out maybe once a month, but it's going to be around the world. So we're going to get into this thing where we can get information from different countries and it'll be immediately, and our journal will create itself it'll be monthly. I mean, we'll just keep recurring, and we'll just print up what comes, organize and print up what comes over the communications, and this is all in place, and if you got a personal computer, you can do it. So
Yeah,
we're going to be working on that.
And the other thing, right now, I mean, there's Medline. If you have a good library in your area, they'll probably have these little silver platter discs that you can.
Okay. I know all those, I know I can get all that information. That's not the thing. I'm just wanting to question right now the validity of these studies and how important they are, because here it says tooth decay rates appear unrelated. Is that, how strong is that appearance?
Very strong.
It seems to cast down on fluoridation.
Okay, here's, how many of you have a copy, purchased a copy of Fluoride the Aging Factor? I will say, on additional copies, if you'd like to have additional copies, I suggest you get them at $5 a piece. As a matter of fact, just go.
Wait, later will it come down more? It went from 8 to 5 now.
The autograph
That's the quantity purchased.
you said the autograph is 5 cents, right?
Quantity of
Right.
one?
Okay.
All right.
4 or more.
So we get together.
I'm working for him.
No, I don't, it makes a little difference. If you'd like to, I mean, you can get all the books at $5. That's quite all right. That's not a problem. Because we're going to need far more money than what we're going to get in sales to get this thing beaten. But in chapter 14, I go through, for example, not every single study, the major studies they used to try to show that fluoride reduces tooth decay. In 1980, and I'm glad you brought this up because this is what I like to have. In 1980, we got the Center for Disease Control to admit that there's not a single, never has been a single laboratory study showing that the amount of fluoride used to fluoridate public water supplies, which is 1 part per million, is effective in reducing tooth decay. Now, we've gone one step better because at Ohio State University recently, since 1980, there was a study that claimed that 1 part per million fluoride reduced tooth decay, and that a 1/2 part per million fluoride reduced tooth decay, and that a 1/4 part per million fluoride reduced tooth decay, and that a 1/4 part per million did it as well as 1 part per million. And then the same study also showed, and I have this study cited in another report which I think I can give you. As a matter of fact, I can give you the reference because I got the report right here. Another study that they did found that when the rats drank Coca-Cola instead of water, that 1 part per million in Coca-Cola actually increased tooth decay rate. Now, quite frankly, I think the Ohio State University study is a poor study. I don't think their results are reliable. They're not statistically significant, but that's the only study I've ever seen. And even that comes up, I mean, if you ask yourself, do kids drink more water or Coke? Is fluoride actually causing tooth decay? No, I don't think fluoride is causing tooth decay. In the Grand Rapids Muskegon study, Grand Rapids was fluoridated around January 1st, 1945. Muskegon was taken as the control group, no fluoride at all, to see what would happen to tooth decay rates. Well, what they found out, and this is in chapter 14 of the book, you can see for every single age group, you can see the results. They found the tooth decay rate in Grand Rapids from 1945 to 1950 dropped. Unfortunately, in the control city from 45 to 50, they also dropped. We know now they've been dropping for about 40 years. What they did in 1951 is they fluoridated Muskegon, say we can no longer deprive the people of Muskegon the benefits of fluoride, and only reported the tooth decay rate went down in Grand Rapids. Newburgh-Kingston was another study that was done. They just did a study last year, 1989. The New York Department of Health did a study. What they found is that from, I guess it was 1950 to 1986 or something like this, tooth decay rates actually went down more in Kingston than in Newburgh. And that was published, and I have the citation for that in my most recent study.
In that book?
It won't be in this book. This is 1986, but I do have the other study here. Now, what we did was this: the National Institute of Dental Research in 1979-1980 did a study of 40,000 school children. We asked it through the Freedom of Information Act. They said we don't have the data. They lied to us. 1967, 66, 86, 87, they came out with another study. They came out with this big headline: tooth decay. About 50% of the children 5 to 17 have no tooth decay. Wow, sounds astounding, doesn't it? How many people believe that? Do you find that in your practice? Here's what they didn't say was they were looking at permanent teeth only in people 5 years old and 6 years old and 7 years old and 8, 9, 10, all up to 17. Well, sure, it's about 50% because about 50% of the kids, their teeth were deciduous teeth anyhow.
Well, didn't they have a control group?
No control group, that was it. They were comparing it, no, that was 50%. All they were saying was 50% are caries free. They didn't mention they were talking about permanent teeth. Now I can tell you, because we have the actual data, that that is not true at all. And as a matter of fact, if you do it by age group, you find among 17-year-olds, only 13% are decay free. And 17-year-olds, you know, it goes up and up and up, obviously. And then, of course, when the deciduous come, you have, you know, decay in deciduous teeth, no permanent teeth, and permanent teeth on up. So what we did was said, look, and then they had the nerve to say this is because of the fluoride in the water. Our scientists believe. Our scientists believe this is due to fluoride in the water. That there's been great reductions in tooth decay. Well, Mark Diesendorf, who is a statistician in Australia, pointed out the tooth decay rates declines, and that is in, I should pass this out to you too, this is a Lifesaver's Guide to Fluoridation. This is 1988. It's been found by proponents and opponents of fluoridation the tooth decay rate is going down virtually the same in both fluoridated and non-fluoridated areas, and has been for quite a while. In this, you'll get an update on that. These, for those people who paid $8 for a book, this is a $1 pamphlet. So now I'll take it down.
Such a deal.
Such a deal. But in any event, it has been pretty well agreed the tooth decay rate is going down both in fluoridated and non-fluoridated areas. Now, let me tell you about what we did. We couldn't get the 79-80 data. We still don't have it, and now we have Congress going after it for us. I have a feeling before we ever get the data, we'll probably have fluoride out of the country coast to coast. And this will probably be used as a kicker, because I'm not only out to get the fluoride out, I want to get NIDR out of the Public Health Service, or get something into NIDR that will reflect, how should I say, a mentality that is more open-minded than what's there. And we've got a bunch of crooks there.
Question?
Yes.
You've been talking all the time about fluoride in water.
I'm not going to stick with that, and we'll answer the other questions on other topicals and so forth later. Is that okay?
I just wanted to comment that I can recall reading about Procter & Gamble's studies done at Indiana University.
By Mueller.
Yeah, back 1960,
50s.
64, something like that,
Yeah.
around that time. where they did show that the topical application of fluoride and fluoride in toothpaste was efficacious as far as tooth decay goes, reducing it. They didn't show any studies about what this does as far as the system when this is just used topically in the mouth.
Well, again, I will address that. I will say that I have been in contact with Anthony Volpe. How many familiar with him? Tony Volpe. He's the worldwide dental director for Colgate-Palmolive, and he admits that my study is correct. He said the fluoride in water does not reduce tooth decay. He said that in fluoride in toothpaste, which I find probably an average of about 10 to 20% reduction in tooth decay, and the topical applications given every 6 months are virtually ineffective in even touching tooth decay. This is really, the current thing. The idea is that if you have topical at about 1,000 parts per million, which you have in toothpaste, this will somehow either reduce bacteria to the point that they will not inhibit remineralization or will actually stimulate remineralization itself, the fluoride in the toothpaste. That's the current, that is what is 1990s technology, according to Tony Volpe. Now here you have, a person who's not exactly a little old lady in tennis shoes, pointing out that, but let me talk about the study. Let me get into the study. We couldn't get the 79-80 data, but we got the 86-87 data. You can see the data over there, which shows that at every single age group, there's no difference in tooth decay rate. We're talking about a study here that is so large that is equal in size to every single other study ever done in the history of the United States. That's how big it is, 40,000. That means in each age group, if you average it out, you've got about, how many age groups? You have 14 age groups, and about 3,000 in every age groups, 84 areas. Now the research report that I hope, let's see, it's in here. Yeah. This is an unpublished research report because of attempts by the NIDR to stop it from being published. And as far as I'm concerned, I'd like to get copies into the hands of the people who would like to read it. But I'll go through a number of things here. The actual, when we total the whole thing up, the tooth decay rate in the fluoridated, I'll give you, they're right here. The tooth decay rate in the fluoridated area was 1.96 decayed, missing, and filled teeth. In the non-fluoridated was 1.99 decayed, missing, and filled teeth, not significant at all. And the partially fluoridated was 2.18 parts per million, which was marginally significant, but still not significant. The average number of, the next one was the number of decay-free children in the three areas. In the fluoridated areas was 34.4, and the non-fluoridated areas 35.0. Again, not significant, but still better as far as decay-free. And the percentage of decay-free in the partially fluoridated areas was 31.3. Again, different but not statistically significant. What we did notice when we really honed in on the 5 to 8-year-olds' baby teeth, if I don't have the data in front here, was a slight reduction in tooth decay in the baby teeth of 5-year-olds only. 6-year-olds was marginal, 7 and 8 were significant. And we believe that those figures are also significant, that we are getting a slight reduction, and that reduction is due not to the fact it's doing anything about tooth decay, but it is actually delaying eruption of the baby teeth. We cited references supporting that. So that, that is as detailed as I can give it to you from here. Now, what about other studies? We've had other studies that have been confirmatory, or ours have been confirmatory too. In 1987, Dr. Alan S. Gray did an epidemiological study throughout Canada, which he did not give good tabulated results for, but he pointed out that British Columbia, which is the least fluoridated province of all of Canada, has the lowest tooth decay rate. And then he looked at, within British Columbia, he looked at fluoridated and non-fluoridated areas and found that the highest decay-free areas were not fluoridated. Now, because he didn't provide figures, I can't even say whether his results are significant or not. The man has been a major proponent of fluoridation and still is. I don't know how he justifies it, but I give some of his quotes on the pamphlet and the Lifesaver's Guide. In 1988,
He gets it out of the table.
but there is no table. He didn't present a table. I have the citation in the Lifesaver's Guide there. I think it's Journal of the Canadian Dental Association, 1987. I've got the page number and everything, so you can look it up. But he puts no tables in there. In 1988, is one of a number of studies done by Dr. John Cohorn, the former chief dental officer for Auckland, New Zealand, the president of the Fluoridation Society, who apparently had a little more conscience because when he found out the damage that was being done to teeth by means of dental fluorosis, the white chalky spots that you see, 20 to 30%, which is